Welcome to this week's Roundup from Hill Security Dispatch, the trusted resource for real-time information, analysis, and insights on global healthcare cybersecurity. Cyber attacks on U.S. hospitals have more than doubled in recent years, putting the viability of the U.S. healthcare industry at risk, according to a Side Effects Public Media article. One such attack targeted Johnson Memorial Health in Indiana, where hackers demanded a $3 million ransom, which the hospital refused to pay. The attack caused significant disruptions to patient care, forcing hospital staff to resort to low-tech methods. This resulted in long-term financial losses and billing delays. In addition, the emergency department had to divert ambulances, and the obstetrics unit struggled to monitor vital signs. Given that cyber attacks on hospitals cost an average of $10 million per incident, healthcare institutions must take proactive measures, including implementing robust cybersecurity measures and having disaster recovery plans in place. Paying ransoms is not recommended, as it could result in legal and financial liabilities. Find out more at healsecurity.com. A ransomware attack that disabled Dallas government computers has raised concerns about potential risks to public health and safety, according to an article in The Washington Post. In addition to the well-documented economic impacts of ransomware attacks, they can also pose a physical risk to public health, causing delays in surgeries, disruptions in accessing medical records, and difficulties obtaining prescription medications. A bill passed last year now mandates critical infrastructure owners and operators to report major cyber incidents or ransomware payments to the federal government. Find out more at healsecurity.com. Cloud-based healthcare technology provider NextGen Healthcare suffered a data breach last month that exposed the personal information of more than 1 million people, cybersecurity news site Dark Reading reported. Hackers used stolen credentials to gain unauthorized access to the database. Following the breach, personal identifiers and social security numbers briefly appeared on a leak site, raising concerns of identity theft. In 2021, healthcare-related organizations experienced the highest percentage of cybercrimes, accounting for 24% of incidents across all sectors. Find out more at healsecurity.com. Hospital IT security leaders are under mounting pressure from ransomware attacks, budget restrictions, and personal liability concerns, Beckers reports. According to a survey by security firm Proofpoint, 60% of healthcare cybersecurity executives feel vulnerable to a cyber attack in the coming year, with half admitting that they are unprepared and 44% impacted by budget cuts. Personal liability is another escalating concern. As patient care expands beyond hospital walls, the incidence of personal liability is predicted to rise, and traditional insurance may not provide coverage. Find out more at healsecurity.com. Thank you for your time. I'm your host, Kurt. For the latest healthcare cybersecurity threat, risk, and alert intelligence, subscribe to our information and insight service at healsecurity.com.